Our next speaker is Dr. Steffen Gay. Steffen is a professor at the Center of Experimental Rheumatology at the Department of Rheumatology at the University Hospital in Zurich, Switzerland. He received his doctorate of medicine at the University of Leipzig. Steffen has had the EULAR Center of Excellence. He's been the director of WHO Collaborating Center of Molecular Biology and Novel Therapeutic Strategies. He has over 500 publications. He's been the founding editor of Matrix Biology and associate editor of Arthritis Research and Therapy, current rheumatology reports. And he's going to talk about what novel drugs do we need for the treatment of rheumatoid arthritis. Steffen.
Okay, this is really great to be back. It's like homecoming here because I spent 20 years at UAB, and usually in early summertime or late summertime around Labor Day, we always came with our 3 kids here to Destin to have some fun. Anyway, unfortunately the sun is not shining, so anyway, it's good to see old friends. Now, David has asked me to talk about novel drugs for the treatment of rheumatoid arthritis. Let me just give you a short introduction into joint destruction and the mechanism operating in the pathogenesis of rheumatoid arthritis. Joint destruction is really the most characteristic feature of the disease, and this is mediated by an hypoplastic synovium. If you look, for example, at the time of arthroscopy with a magnifying glass in a rheumatoid joint, you see that there is a hypoplastic synovium which has been growing over the cartilage, but that little pieces of this synovial tissue became actually loose and have attached to the cartilage. Because there is such high proteolytic activity, so many enzymes are produced there, that this tissue becomes disintegrated and attaches also to the cartilage. Now, if at the time of joint replacement surgery, you, for example, cut through such a human joint, you see where the synovial tissue has attached, it has invaded down into the cartilage. Not only into the cartilage, it has already also invaded down to the bone marrow space and is eroding the bone. You see there's some fibrin covering this area of destruction. And if you would take, for example, here a biopsy and send it to your favorite pathologist and ask, what do you see? He would say, nothing special. We see a lot of macrophages, occasionally a T and a B cell, and some unsuspiciously looking fibroblasts. But you see, this tissue is a very aggressive tissue. Like a tumor, it invades the strongest tissues what we have, cartilage and bone. So it means this is a very powerful force behind this entire mechanism. And you all know this is an autoimmune disease characterized by the influx of immune cells such as B cells and T cells into the synovial tissue, which is facilitated by an early angiogenesis by facilitating the influx of macrophages, for example, which produce the most powerful enzyme cytokines such as TNF, IL-6, and IL-1. And there are synovial fibroblasts, which are found at the site of invasion both into cartilage and bone. And these fibroblasts are producing factors such as rank ligand, as we have shown, turning some of these macrophages into osteoclasts. And these osteoclasts then upregulate cathepsin K or matrix metalloproteinases and destroy and erode the bone. So we have here a concert of interacting cells. Now, if you look at all the therapies which we have, we can target some of these key players. We can target the macrophages. Initially, we have been targeting IL-1. Then we have been targeting TNF or IL-15 or IL-6 receptor. We can eliminate this macrophage.